One of the most transformative things I've witnessed is how people experience profound healing when they combine Western's medicine scientific method with the ancient wisdom of Ayurveda. Think about it. Western medicine is unparalleled when it comes to emergency care, surgery, and interventions that save lives. It is precise, focused, and based on evidence based on practices, but often overlooks the emotional, mental, and lifestyle aspect of health. That's the very thing Ayurveda excels in addressing. Hey everyone, welcome back to A Talk with G, the podcast where we explore ancient wisdom, modern wellness, and everything in between. I'm your host, Gia, and today I have a fascinating topic that's been on the minds of many: Ayurveda versus Western medicine. We often hear about Ayurveda versus Western medicine, but I've got to be honest, I'm not really a fan of the verse part. After all, these two systems aren't necessarily at odds with each other. Instead, they each bring something valuable to the table. Now, I've spent many years with one foot each in both worlds, embracing the timeless wisdom of Ayurveda while also being exposed to the advancements of Western medical science. And I have to tell you, I've seen firsthand the benefits of both systems. And I truly believe there is a place for both in our health and healing. And it's not about picking one over the other, it's about understanding what each system offers, how they complement each other, and how we can use them together to achieve holistic well being. That's what we'll be discussing today. This episode is going to dive deep into the contrast between two very different approaches to health, healing, and wellness. We'll explore how Ayurveda, the ancient science of life, compares and contrasts with Western medicine, which has become the dominant form of healthcare in many parts of the world today. From philosophies and methods to practical applications and outcome, we'll cover it all. So grab a nice cup of warm tea, get comfy, and let's explore how these two systems approach healing. Let's start by talking about the core philosophy behind both systems. Ayurveda, originated from ancient India, is a deeply holistic system of healing. It's not just about treating diseases, but about understanding the balance between the mind, body, and spirit. In Ayurveda, health is defined as harmony within oneself and with the environment. This system is based on the idea that everything is interconnected, which it is. The physical body is influenced by the mental and emotional states, and the health of the body is linked to the quality of life, diet, lifestyle, and even the seasons. At the heart of Ayurveda is a concept of balance between the three doshas, our energies, vata, pitta, and kapha. These doshas represent the five elements: earth, water, fire, air, and ether. Each individual has a unique dosha constitution, and Ayurveda emphasizes that when these energies are in balance, the body's healthy. But when they are out of balance, disease can manifest. Western medicine, on the other hand, is rooted in the scientific method that focuses primarily on the diagnosis, treatment, and prevention of a disease through physical means, whether that's medication, surgery, or other interventions. It tends to be more reductionist in nature. Western medicine breaks down the body into smaller parts, seeking to fix specific issues with specific parts. And it's incredibly effective in treating acute conditions and emergencies. But it doesn't always address the underlying root cause of chronic issues. It also doesn't typically emphasize the emotional, spiritual, or environmental factors that contribute to health problems. Right off the bat, we can see the core difference lies in perspective. Ayurveda views health as a balance of energies and a deep connection between body, mind, and spirit, whereas Western medicine often focuses more on physical symptoms and immediate interventions on specific parts, one at a time, to treat those symptoms. Now, let's move on to treatment methods. Natural remedies versus pharmaceuticals. Again, not against it. Both bring so much to the table. But this is where Ayurveda and Western medicine really begin to diverge. In Ayurveda, the treatment of a disease is deeply personalized. It takes into account your unique dosha, the state of your mind and emotions, your lifestyle, diet, and environment. Treatments in Ayurveda are based personally on the individual, and treatments might include herbs and plant-based remedies. Ayurveda is known for its rich tradition of using herbs and spices like turmeric, ashwagandha, holy basil, and ginger to treat everything from digestive issues to anxiety. Dietary changes. While looked at in both concepts of both worlds, Ayurveda places a great emphasis as food as medicine. The idea is that what you eat directly impacts your health, and eating according to your dosha and the seasons help keep you balanced and prevent illness. In Western medicine, we are told to eat more healthier. However, not everyone has the same dietary restrictions or allowance. Yoga, meditation, and breathing techniques. These practices are integrated into Ayurveda, helping to calm the mind, reduce stress, and align the body, contributing to overall well-being. It's not just about getting physically active, it's also getting your mind and emotion in a balanced state. And Panchakarma. This is a detoxification process that uses a combination of herbal treatments, oil massages, steam therapies, and other practices to cleanse the body of toxins and restore balance. With all that said, those are some of the treatments that Ayurveda offers. However, with each one I mentioned, it's personalized to each individual. Western medicine, by contrast, often relies on pharmaceutical drugs to treat specific symptoms or conditions. While these medications can be highly effective in addressing certain health issues, they often come with a side effect, and they don't usually address the root cause of a problem. For example, if you have high blood pressure, Western medicine might prescribe medication to lower it, but it doesn't necessarily explore why your blood pressure is elevated in the first place. Additionally, Western medicine tends to rely heavily on surgery as a solution to physical issues. And while surgery can save lives, and sometimes it's absolutely necessary, it's not always the best solution for chronic conditions. This is where Ayurvedic shines, with its focus on preventive and restorative practice, taking a holistic approach to healing. One of the criticisms of Western medicine that I've learned over the years is that it's often reactive rather than proactive. It waits until an ailment or a disease presents itself at a serious situation before taking action. Where Ayurveda encourages preventive care through healthy lifestyle, balanced diet, and regular self-care practices. And while Western medicine has evolved, and it's an amazing thing that we have at our fingertips in case of an emergency, it doesn't take in account for all the other attributes that may cause an issue to arise. Now, I'd like to touch on how these two systems approach diseases. Symptom management versus root cause healing. This is where we will really see the difference in action. In Ayurveda, illnesses is viewed as a result of imbalancement in our doshas within our body, mentally, emotionally, and physically. These are usually or often caused by poor lifestyle choices, incorrect diet, stress, environmental factors. The goal of Ayurveda is not just to treat the symptom, but to address the root cause of the imbalancement. Therefore, you're not repeatedly trying to fix the top problem, but you're actually diving deep to see where it comes from. For instance, if someone is experiencing chronic digestive issues, Ayurveda wouldn't just give them a pill to suppress the symptom. Instead, it would look at their diet, their stress level, physical activity, mental state, environment of work or home life to determine what might be contributing to the imbalancement. From there, Ayurveda would create a tailored treatment plan that includes dietary changes, herbal remedies, lifestyle modifications, along with physical movement to restore balance to the system, along with meditation or yoga. And while that's absolutely great, and everybody's like, well, I do this, the difference is not everyone can have the same plan. And that's what makes Ayurveda stand out. It is personalized per person. Western medicine, however, tends to be more focused on symptom management. If you go to the doctor with a digestive issue, you might be prescribed a medication to reduce inflammation or suppress stomach acid. And while that can bring immediate relief, and that is great, doesn't necessarily address the underlying cause of the digestive problem. And it doesn't restore the body to a state of balance. And most times when you take something to fix a topical problem or a onset problem here, you're also feeding another problem that wasn't awoken because of side effects. The symptom-focused approach in Western medicine can be very effective in short term, like I've mentioned, especially for acute condition, infection, or injuries. However, when it comes to chronic disease like autoimmune disorders, chronic pain, and mental health conditions, this is where it actually falls short for us. It doesn't offer a long-term solution because I've seen it firsthand. I've been in the practice. We would prescribe something that would help today, tomorrow, 2 months, 3 months. But in 3 months, you're going to have to reevaluate what you've been on. And that's the beauty of Ayurveda. It offers a more comprehensive root cause approach that goes beyond symptom management. And with that being the whole picture of this, it's not that Western medicine is bad. No, it's absolutely great, again, for emergency-based situations. But if you are not in an emergency-based situation, it shouldn't be your first approach to solving an issue. Another key difference between Western and Ayurveda medicine is their approach to mind and emotion. I've learned this firsthand. Ayurveda has deeply holistic understanding of the connection of our body, mind, and spirit. It teaches that emotional and mental imbalancement are just as important as physical imbalances. And when it comes to overall health, you need to address all three. Conditions like stress, anxiety, depression are seen as manifestation of imbalancement in the mind and the doshas. They are treated with such methods like yoga, pranayama, breathing exercises, meditation, and herbal treatment designed to calm your nervous system. Ayurveda understands that emotional health is fundamental to physical health. When you are stressed or emotionally unwell, it impacts your body's ability to function properly. Addressing emotional and mental health is therefore a priority in Ayurvedic treatment plans. Western medicine, while it is beginning to recognize the connection between mental and physical health, it has historically placed less emphasis on mental and emotional wellness in the treatment of physical illness. Western medicine often treats emotional or psychological conditions with medication, such as antidepressants or anti-anxiety drugs. These medications can help balance brain chemistry, but they don't often address the root emotional cause of the imbalancement. In recent years, however, there has been a shift toward a more integrated approach in Western medicine. Many doctors are now recognizing the importance of mental health and overall well-being, and more treatments are becoming available that combine medication with therapy, mindfulness, and lifestyle change. But it's still a relatively new shift compared to Ayurveda, which has always understood this connection. And it's not saying that they're behind, it's saying that in the Western medicine world, it is still new. So not a lot of people are open to the idea. And therefore, a lot of people are not speaking up with these situations. Now that we've explored the difference between Ayurveda and Western medicine, let's talk about something that I believe is incredibly important: the power of integration. After years of having my feet in both worlds, I can confidently say that there's a growing shift towards combining the best of both systems to create a more holistic and effective approach to health. As many of you know, I work closely with clients who seek balance in their lives, balancing work, health, and wellness. One of the most transformative things I've witnessed is how people experience profound healing when they combine Western's medicine scientific method with the ancient wisdom of Ayurveda. Think about it. Western medicine is unparalleled when it comes to emergency care, surgery, and interventions that save lives. It is precise, focused, and based on evidence based on practices, but often overlooks the emotional, mental, and lifestyle aspect of health. That's the very thing Ayurveda excels in addressing. Ayurveda, on the other hand, is all about preventive care, restoring balance, and treating the root cause of illness. It takes into account the body's interconnected systems, mind, body, and spirit, and focuses on promoting overall well being through lifestyle changes, diet, herbs, and stress management techniques like yoga and meditation. But Ayurveda does not have the same tools as Western medicine does for dealing with acute emergencies and infections. So the magic happens when we integrate these two systems. Imagine someone dealing with chronic pain, for example. A patient might seek treatment through Western medicine to manage the pain, immediate pain, perhaps through physical therapy or medication. But at the same time, they could work with an Ayurvedic practitioner to look at the root cause of the pain, whether it's in an imbalancement of the doshas, stress, lifestyle factor, and use Ayurvedic methods like diet adjustment, herbal supplements, and yoga to support healing from within. Similarly, someone experiencing stress or anxiety might benefit from a combination of therapies. Western medicine may prescribe medication to help the symptoms of anxiety, but Ayurveda can offer practices such as meditation, mindfulness, and teas like ashwagandha or holy basil to work to soothe the nervous system and address the emotional root cause of the anxiety. With this said, we're now entering an era where more and more people seek a well rounded approach to health. And thankfully, integratively, medicine is becoming more accessible. There are healthcare practitioners out here that combine both worlds, offering treatments that marry the scientific and holistic together. Whether you're working with a doctor or an Ayurvedic practitioner, the ultimate goal should be to focus on your unique needs and create a comprehensive health plan that blends both worlds in a way that is personalized for you. What I love most about the integrated approach is the empowerment it brings to an individual. It encourages us to take an active role in our health and healing, combining the best of modern science and ancient wisdom. It reminds us that wellness isn't just about fixing a topical problem, but about fostering a deeper understanding of ourselves and living a life that supports lasting balance. So there you have it, a detailed comparison between Ayurveda and Western medicine. Both systems have their strengths, and each one offers something valuable. Western medicine is unparalleled in its ability to address acute issues and emergencies, while Ayurveda offers a holistic preventive approach that treats the root causes of imbalancement. In today's world, many people are turning toward integrative medicine, combining best of both systems to create a more balanced, effective approach to health. If you are looking for more personalized guidance on balancing your body, your health, optimizing your health, or creating a holistic routine, feel free to visit my website at www.soul-sinks.com for more information. I've been lucky enough to integrate both systems into my life and the lives of my clients and family, and I'd love to help you find your own personal harmony. Thank you so much for tuning in today. If you enjoyed today's episode, please don't forget to subscribe, leave a review. Until next time, stay healthy, stay balanced, and remember, true wellness is about finding harmony in every aspect of life.